Hello, everyone. Dr. Stillman here with Amy Arp and Clark Engelbert, and today we are talking about HTMA and hormonal health. Clark, Amy,
Mhm.
how are you guys today?
Good.
Great.
What's going on?
Doing great.
Excited
Really
to talk about
excited to be
hormones.
here.
I think that's
Excited
a
to
huge
talk about,
topic.
excited to talk about hormones and HTMA.
Yeah, I mean it's a really deep topic. We could probably spend multiple of these Q&As on this.
And
So
let's just dive right in. The reality is that this is one of the most interesting things about HTMA, which is that
Hmm.
there are a ton of connections between hormones, neurotransmitters, and minerals. I'll give you a really clear, totally not out there, very well validated and grounded in the literature example, which is um, magnesium, progesterone, and GABA. So the GABA receptor, GABA is a neurotransmitter in the brain. That receptor is activated by magnesium and by progesterone.
mm,
And so if you have enough magnesium and progesterone around, the GABA receptor works better.
mm,
And so this is just a classic example of how this all works together. The reality is there's dozens of minerals, there's dozens of hormones, there's dozens of neurotransmitters. The idea that we could possibly elucidate how all of them work together in all the different ways they could possibly work together is a little bit ridiculous.
right.
But what you do see in the real world, taking care of real people, is that on high doses of minerals and appropriate mineral balancing protocols, people will see profound improvements in things that they had attributed to hormonal imbalances, which is part of why
Mm,
when people come to us and say, well, I think my this is imbalanced or my that's imbalanced as far as a hormone goes, what we end up often asking them is, well, do you think this could potentially have to do with your mineral balance? And they often have never considered that or been proposed that. And then they're sometimes shocked by how much these problems improve once we sort out what's going on with their minerals.
Yeah, and I mean just to piggyback off of like the complexity of this with what you were saying with respect to progesterone, and adding in another variable there with the heavy metals, mercury and other metals, but mercury in particular has been demonstrated to inhibit conversion of pregnenolone to progesterone. So that can lower progesterone levels, along with most of the metals being what we call estrogen mimics, which have this capacity to stimulate estrogen receptors. Um,
Right.
and that's just one example of, you know, hundreds we could probably sort of pick out, when you understand how metals and minerals and the hormones interact. But we can use the hair tissue mineral analysis in some really interesting and unique ways to do kind of like a quasi complete hormonal panel on a lot of people. And that's the primary. It's at least one of the primary ways in which we're using the HTMA, which I think is definitely a bit different than a lot of other people out there who are just using HTMA to like look at individual mineral levels. But when you understand this interaction between the minerals and the hormones, and the hormones and the minerals, you can use a tissue test like the hair test is to measure, let's say, this cellular effect of adrenal hormones, thyroid hormone, even insulin as well, in this sort of mineral balancing type of interpretation. So we can use the HTMA. The HTMA is sort of like the tool that we're using in mineral balancing to measure minerals. But when you understand how minerals and hormones interact, you can go sort of like a layer deeper and start to look at like the cellular effect of many different hormones.
Yeah. So let's unpack that. So
Yeah.
probably the number one thing that I see happening with well, I don't know, number one. It's hard to say. Let's just talk about some basic mineral correlations. So when I think magnesium, I also think of progesterone. When I think of copper, I also think of estrogen. When I think of zinc, I also think of testosterone. Now, there's more besides that. Like, for example, I would say zinc also goes along definitely with things like thyroid hormone and things like the adrenal hormones. And that's where it gets a little bit fuzzy, which I think frustrates people. They want it to be cut and dry. They want it to be simple. They want it to be amenable to the very like reductionistic thinking that we see in Western biomedical sciences. Clark, I muted you because I'm getting some feedback from your end. So we see this with people, and it really, I think, frustrates a lot of them. And it's also why a lot of clinicians and doctors and nurse practitioners and people, particularly in the conventional allopathic world, they don't embrace HTMA, or they're confused by it, or they're resistant to using it. And they're not as interested in learning it as they are other blood labs, because they think that those blood labs are A, as effective, and B, um, they have a lot of value. The truth is, I came over to the HTMA side of things because we started to do hair tissue mineral analysis in my medical practice and started to see the responses people got compared to what we were doing before, which was based on blood elements, blood mineral levels. And we were just blown away. There was no, I mean, I can't say there was no comparison. There was a pretty fair comparison, but it was a significant improvement. And it was also a lot more affordable for people, because instead of doing like a $300-400 organic acid test plus or minus a blood mineral panel, we were doing, a $100 hair tissue test, which is, especially if you want to do them quarterly. And that's something that we really stress with people more and more, is that if you really want to achieve optimal health, it's a process of balancing minerals quarter by quarter. One of the biggest complaints we see from people who are coming out of the functional medicine space is, I spent thousands of dollars on lab testing and appointments, saw my doctor twice, got handed a ton of supplements, saw some improvements, maybe profound, but often what they didn't see was a sustainable program that they could stick with. And B, they saw mild or moderate improvements that then regressed when they went off the supplements, or fell off the wagon with a very restrictive diet, and they weren't sure, well, what did I not address that was underneath all this that I could have addressed? And that's where the minerals and mineral balancing shine. And this is the part where I have to plug the mineral balancing course that we offer, HTMA Secrets with coaching. It's a weekly call where you will get to go over tests with Clark and I. It's amazing. We were getting some rave reviews and testimonials Monday in our coaching call, which Amy will be collecting and posting soon enough, I think. Amy, do you have an ETA for those?
I don't yet, but soon. It will be soon. So we're
Probably the
hoping
next couple
before,
weeks,
yeah,
before like
yeah, next
September,
couple
right?
weeks. Yes.
Yeah. So look for those. And you get a weekly call with us. You get an HTMA test. And then we will also walk you through like supplementation protocols based on these tests. So it's a very impactful course, and Amy can drop a link to book that. Do you want to drop a link to book that, or do you want to drop the waiting list in the comments,
I'm
Amy?
gonna do the waiting list for now. So the link I'm gonna drop is
Sure.
the waiting list. Put your information in there, and we will get you all the information this week. So
Yeah.
one thing I was thinking of that you guys could touch on is
Mhm.
thyroid. So I think a lot of people come to you with thyroid issues, and you have
Yes.
seen phenomenal results through the HTMA in terms of thyroid hormones. If you could both explain that a little bit, that would be great.
Yeah, let's talk about the fact that, the hair tissue test doesn't directly measure hormones. But what you will see is there are patterns in the hair tissue test that correlate with what people end up being told are related to hormones. So let me give you guys a really clear-cut example. In the anti-aging functional integrative medicine world, you'll see that people often have symptoms of low thyroid hormone until their free T3 runs up to about 4. And depending on who you ask, optimal ranges are upper quintile, 4 to 4.3, 4 or over. There's a lot of people out there who will debate on this, and I'm not here to get into that. But the point is, higher levels of thyroid hormone give people better clinical results and alleviate their symptoms, right? As opposed to most people who are just being replaced by their doctors to TSHs that are under 4.5 or 4, and they still have a ton of residual symptoms, mostly because the top drug for thyroid hormone replacement really doesn't work well. It's a terrible drug. It doesn't convert into T3 maybe at all. It may actually shut down T3 conversion, which is why many people say that they feel worse on levothyroxine than they did before. Either way, what you'll see in these folks is that they will see the same symptoms that respond to replacement of free T3 or T3 with something like Armour thyroid or compounded T3, T4 or compounded free T3 alone. You'll see the same complaints that respond to those things responding to mineral balancing. And as you see that happen, you will see, number one, these people almost always come in with a high calcium to potassium ratio, which is what we call the thyroid ratio on the test. As that ratio normalizes, many of these complaints improve. And while you may not see a change in their thyroid hormone numbers, you're not treating a number, you're treating a patient. You're not coaching or counseling a number, you're coaching or counseling a client. So that's the beauty of this hair tissue testing, is a lot of these things that people are thinking are hormonal, they're really linked to these nutritional imbalances that can be approached. And really, I would say they can be viewed in a completely different light when you get the hair tissue test. So that's like how I think about thyroid testing and the hair tissue test. Clark, what are your thoughts?
Calcium potassium ratio is the main mineral ratio that we use to assess thyroid hormone status. And like you said, it's not measuring thyroid hormone in the blood directly by any means, but the calcium and the potassium are involved in thyroid hormone metabolism in some interesting ways. And that's how we can sort of tie this to the cellular effect of thyroid hormone, and specifically that calcium potassium ratio when we sort of hone in on that. And as we go through, like in our course in HTMA Secrets, we did an entire hour and a half on thyroid hormone and adrenal hormones, and how we look at them through the lens of HTMA. So if you want a deep dive on that, we go into this in some depth in the course. But that calcium potassium ratio is interesting because you can correlate it to the cellular effect of thyroid hormone, because calcium is used by the body to desensitize the cells to thyroid hormone. And the potassium is similarly used to sensitize the cells to thyroid hormone. So when you measure the ratio of those two elements, and we understand the hair tissue test as a cellular reading of those elements, we can basically correlate the calcium potassium ratio with the cellular effect of thyroid hormone. And as we go in HTMA Secrets, in the module, in the thyroid module, we talk about all the different steps of thyroid hormone metabolism. Things start in the brain and the hypothalamus. There are signals sent to the pituitary, signals then sent to the thyroid to actually make T4. T4 then gets sent out into the peripheral tissues, into the blood, where it then has to be activated and turned into T3 in the peripheral tissues. And really what we're sort of using the hair test for, or that calcium potassium ratio, is that measurement, or that reading, that parameter is a measurement of a proxy, you could say, or a biomarker for that process, or that step in between when T4 is made, when it's sent out, and then when it's turned into T3 in the peripheral tissues. And at the level of the cell, there's a sort of gating mechanism that the cell has. And that calcium and potassium, the ratio there determines the efficiency, or the rate with which thyroid hormone gets in there. And if calcium is really high relative to potassium, it's almost like calcium is blocking thyroid hormone from getting into the cells more efficiently. And if that happens, you're not going to make or convert T4 into T3 like in the liver and the other peripheral tissues. And so that's a big sort of point, or that's a big step in this giant cascade of thyroid hormone metabolism. And so it is important, I think, to make this distinction between what we're measuring, or what people are measuring with respect to blood tests, what we're measuring with the hair test. We're definitely measuring something different, but this is, I think, a more meaningful measure, more sensitive measurement of what's going on with thyroid hormone than just measuring, let's say, TSH in the blood, which, that can get, I'm sure, as you know, as you've done over the years, that to me doesn't seem as clinically meaningful. Also, when you put together the pieces of the puzzle and understand that as we balance this calcium potassium ratio on a hair test, with the way in which we're doing in mineral balancing, you can affect change much more powerfully, I think, with this test and with this understanding.
Yeah, I mean, to me, the most important thing is that we see people improve symptomatically, right? So, for example, another beyond thyroid hormone numbers, calcium potassium ratios, when we look at something like, for example, people with copper toxicity, and we see people with high hair copper levels all the time, we also see people with hidden copper toxicity. These are people who are going to have low hair copper levels, maybe low or normal serum copper levels. Oftentimes, these people, you can see other indicators on the hair test that the coppers kind of come out later. But what you'll see is these people tend to have, often it's more common in women. They often complain of anxiety. That anxiety often wanes as the copper comes out. What does that have to do with hormones? Well, I mentioned briefly like progesterone. Progesterone helps that GABA receptor work. GABA is an inhibitory neurotransmitter. That to me makes sense. Okay, they're getting rid of this thing that's associated with an estrogen. An estrogen is a really tricky hormone because it's so powerful for the body. It gets a really bad rap. Truth is, all the testing we've done of aromatase inhibitors that suppress estrogen levels has gone horribly wrong. Suppressing estrogen is not a good thing, even though sadly a lot of doctors are still doing it, and probably won't stop in the short term, which is why if you're doing hormone replacement, if you're doing hormone manipulation, you really need to be working with a smart doctor. I don't know anyone who's on the cutting edge in that space who's still using supplements like DIM, supplements like, and that's diindolylmethane for those of you who don't know, supplements, or not supplements, but aromatase inhibitors, like anastrozole. But what you'll see is that people will blame those symptoms on estrogen. And the reality is we'll see the copper then come out and the symptoms get better. And it's remarkable just how consistent that is in practice.
I also think sort of diving a little more deeply into calcium metabolism is also very interesting, because by default, you have to dive more deeply into hormonal, the hormonal regulation aspects of calcium metabolism, right? And there's also interactions between the metals and calcium. And when we see, one of the biggest associations that I see on a hair test is when someone has a really high calcium level, and that almost always usually coincides with an imbalanced calcium-potassium ratio, which is impaired cellular effective thyroid hormone. What I almost always see is co-occurring copper, aluminum, or lead toxicity. And especially with aluminum and lead, these two elements, they've demonstrated in the literature that those two elements can drive calcium out of the bone tissue where it should be, right? And this is sort of putting our toes in the water a little more deeply into calcium metabolism and calcium partitioning. Calcium should be in the bones and teeth primarily, a little bit in your muscles, a little bit in your brain, right? But so as these metals bioaccumulate in your bone tissue, they can drive calcium out of the bone tissue and put calcium into the blood and into the soft tissues, right? So just the presence of the metals can disrupt normal calcium metabolism and cause what we call dystrophic calcification. And that presents on the hair test as really high calcium. And that usually is accompanied by lowered potassium relative to that really high calcium. Because as calcium gets higher, it's less and less likely that potassium is going to be able to keep up with that. So,
right, which is why we're so serious about restoring normal calcium potassium ratios. It's such a clear marker of someone improving overall for their ratios to go from either very high or very low, which is a totally different issue that we haven't really touched on, to somewhere in the ideal range and staying there. And that is the thing that one of the things that impresses me about what we do is that as you take people through mineral balancing protocols, they do tend to really come back into the ideal ranges. And I mean, we see so many people going through the process who they stick with it for 6 months, a year, 2 years, 3 years, because they see the value, they get the benefit, and they see these heavy metals coming out of the body that they know are poisoning them on a cellular level. You know, I was reading something by Christopher Exley, one of our favorite researchers.
Yes.
Foremost aluminum researcher in the world.
The man.
Yeah. We're going to try and get him on a podcast to interview.
Are you really?
We are. Yeah. I haven't told you that, but we are.
We're going to try. We're going to make it happen somehow.
I'm on that call. I don't care what anyone says. I have to be on that call.
Through your calendar, Clark. Cause it may be kind of a tough, depending on when he says yes to a window, you may have to get up kind of early.
I'm there. Chris, actually, I'm there.
But he wrote something. He said, there's aluminum in every single cell of your body. I read that the other day and I thought, wow, that's rather sobering. to think that it's there in every cell. And just for people who are watching this who may be skeptical, there's clear literature out there that all these heavy metals that we're talking about trying to eliminate from the body using mineral balancing, they're endocrine disruptors. They are very well reported to affect how these hormones function, how they work, their production, regulation throughout the body. That's why there's such a problem and why we're so serious about A, minimizing exposure, and then B, trying to get them out as much as possible of the body.
Right. But this also sort of speaks to like all of the interactions between the elements are very important, when it comes to thyroid hormone and these hormones as well. Right.
And I think this is a place where the conventional medical literature is completely just so behind on the clinical reality of taking care of people. Like when you give people the right doses and quantities and proportions of minerals, you see profound effects. And they're running around like, well, we're just like, how do we make this even more academic? I mean, some of the papers I've read on mineral biology are just, I mean, they put me to sleep. And I wonder, how do these researchers stay awake long enough to write these papers? Because they're so boringly academic, and incredibly irrelevant to anything in the real world. Which is sad, because the sad thing about that is that minerals couldn't be more important for human health. They are the spark plugs of life. They are the building blocks of life. And which is why, we're not running around really giving people like high doses of amino acids or carbohydrates or fats. We might change those and, engineer someone's macros. We're paying close attention to what's coming in as far as mineral content. And that's what we see getting people lasting, durable, significant results. So
we have a question here from one of the social media channels. Can you touch on HTMA ratios for adrenal function?
Yeah, that's a really good question, and I think that was sort of naturally where I was going to go next with it. But
shoot, go ahead, Clark.
Yeah, so there's a couple different ways to look at adrenal function by looking at the HTMA. The first way is just by looking at the sodium and potassium levels. Sodium and potassium are regulated in the tissues by aldosterone for sodium and cortisol for potassium. And so when we look at the readings of those elements, it's essentially a measurement on the hair test of the cellular effect of those hormones. Now, if you have like a low sodium and potassium, that means that the cellular effect of aldosterone and cortisol is suboptimal. Right. And
can you define that real quick, Clark, just so people understand? What do you mean by cellular effect?
So like aldosterone and cortisol have to be made in the adrenals, and then they have to be put out in the tissues in the same way that thyroid hormone does. So as those hormones are put out, they have to go into cells. And as that happens, or as it happens, we're sort of measuring that effect of the hormone on the cells.
Because they're affecting the creation of the hair.
Exactly.
Right.
Exactly. So we're measuring basically the cellular effect of those hormones. And it's quite different than measuring, let's say, the intake of those elements in the diet, which does influence to some degree what we're seeing on the test. But a lot of people get confused because they conflate those two things. They conflate like, oh, well, the hair test is a reading of only the intake of those elements in the diet. But it's really not, Dr. Stillman, and as you say, as you've said in many prior Q&As and many prior calls that we've done, it's a measure of intake, metabolism, and excretion, essentially, right? And so looking at the sodium potassium levels is a very good way to assess that. Looking at the sodium potassium ratio, that's another really interesting way to look at adrenal function. We can also look at the sodium magnesium ratio, right? So there's three major ways that we can kind of look at this. Actually, probably even more, but these are the three main ways that we can look at adrenal function. And the sodium potassium ratio is really a measurement of the electrical potential across your cells, or what I like to say is a reading of your cellular battery.
Right. That's what Eck called it, right?
Exactly. So
Didn't you call it like the vitality ratio, the cellular vitality ratio?
Well, I think it started out as like the life and death ratio,
Oof,
and
a little bit
that
too
was a
grim.
little heavy for people, so they changed it to the vitality
Because
ratio.
what we see is big swings in it sometimes, and sometimes it gets worse before it gets better. But of course, we call that retracing, and we cover that in the course, which people can jump into anytime and start to learn how we think about this, how we train people on it. And at the end of the day, the thing that's compelling is that the more that ratio tends to come into balance, whether the absolute numbers go up or down, the more people tend to see improvements in how they feel, how they function. And then often we'll see that correlating with significant eliminations of the heavy metals.
Right.
Which is what we're really after, of course.
Yeah, that I would say the sodium potassium ratio is the single most important parameter on the hair test by far. And because it's a measurement of the electrical potential across the cells or the cellular battery, as we balance it, the charge across the cells goes up dramatically. And when that happens, that electrical signals power a lot of biochemical reactions in the body, especially in the brain. Everyone knows about neurons and electrical signaling there. But a lot of your detoxification systems are sort of innervated or powered through that electrical potential mechanism. So the sodium potassium ratio is definitely very important. The sodium potassium levels also important. This is something that I think a lot of people get confused on, like the basics here. We can measure the ratio or what sodium and potassium are doing relative to one another. We can also measure them individually. And that's what I mean when I say the levels. The sodium level is just the sodium reading by itself. Potassium level is the potassium reading by itself. The ratio is a measurement of those two elements relative to one another, right? So lots of different ways to skin a cat here on HTMA. The sodium magnesium ratio is kind of interesting to look at because sodium and magnesium are regulated. The adrenal hormones regulate those elements in your tissues as well, or at least they're in part involved in their regulation. So we can use that ratio as like another way to assess the cellular effect of the adrenal hormones.
Should we jump into questions, Amy?
Yes, let's answer. So we had one question in the chat. Let's answer this one first. Can proper mineral balancing positively affect or overtake the negative relationship between thyroid disorder and gluten sensitivity?
So I think what you're asking is really, will improvements in mineral balance lead to someone tolerating gluten or any other food allergen better? And the answer in my experience is undoubtedly yes. Many people I've had worked with in the past who we fixed their diet, their lifestyle, put them through multiple rounds of supplementation, their reactions to various things, seasonal allergens, so inhalant allergens, food allergens, just reactions to things that were not even necessarily allergic, like sensitivities to dyes, perfumes, whatever. Those things can improve as well. So it's possible, but there's no, there's no guaranteed timeline. It's not like something like, say, like allergen immunotherapy, where there's like very clear treatment guidelines and protocols for getting people to respond and get clinical results.
We had another question in the chat here from today. And so someone's asking, is it safe to say that these ratios that you're explaining could be mitochondrial function ratios?
Yes, they have everything to do with how the mitochondria are functioning.
Mm-hmm.
But
especially
it's hard to,
especially the sodium potassium ratio. But then, if we understand like electron chain transport, iron and copper are very important for that. And like mitochondrial antioxidant enzymes rely on minerals to work properly. So, we haven't talked about that as much. I think that's something we could probably take an entire hour on in the future, just talking about mitochondrial function and how minerals influence it.
It's funny. I used to get really excited about things like that. And now I just look at the reality of my life and I say, when we do this, people get better. And we could geek out about this like nitty gritty, like, well, the mitochondria is this and the mitochondria is that, and it does this and it does that. And it's just like, we can do that all day, or we could get busy getting people results.
Right.
That's a good point. It's a good point. Yeah. Someone else is asking in the chat, can you have too much magnesium? Because you guys were touching on the different levels.
You can get too much of any individual nutrient.
Right.
You can get too much of. It's rare maybe that someone would get too much magnesium, because magnesium is largely deficient in the soils, like most other elements. But if someone is megadosing magnesium, 3 grams a day of magnesium, and they're in adrenal burnout, you can absolutely get too much magnesium in certain situations.
So what you'll see is, number one, people get to bowel tolerance. They can't tolerate anymore because it's not well absorbed, so they wind up getting loose stools. That's part of why it's extremely hard to get to tissue saturations or levels that are actually going to cause people to have noticeable side effects. In the clinical, like medical world, where you'll see side effects of high magnesium levels is in patients who've got preeclampsia, who are being given high doses of IV magnesium in like an high risk obstetrical ward.
Right.
Because their goal magnesium level is something in the serum. I mean, it's going to vary from center to center, and I don't know the guidelines on this, but they're going to drive that magnesium level up. And one of the ways they would and I remember doing this on the wards as a medical student, you would go in and you would say, okay, well, does the patient still have any reflexes? Okay, they're awake and they're not comatose and they still have reflexes. We can give them more magnesium. It's very, it's the standard of care, but it's you only see that in like a controlled medical setting. And yeah, you can get too much. I think what's happening in our modern world is that people are under so much stress that they're not even aware of, from toxins, sound, physical stress, psychological stress, social stress, that ends up depleting the body of magnesium, and they're not having restorative time. They're not resting. They're not relaxing. They're not going into that parasympathetic state, and they're not eating magnesium dense foods. So it's, do people get too much magnesium? Practically speaking, rare. What you'll see though is people use magnesium to compensate. They have to take it every day for the rest of their life, and they never figure out why. And they're always kind of scratching their head, like, why do I need to take magnesium every day, or I can't move my bowels, not have a headache, have the energy I need, go to sleep, have a normal mood? And that's what we're really talking about addressing with higher doses and more sophisticated protocols of minerals, like organ glandulars, like adrenal glandulars or thyroid glandulars, let alone like other things we do at the medical practice, things like bioidentical hormones, to actually get to the root cause, so that you don't constantly have to keep taking high doses of things, because we just see that ending in, misery for so many people. And this is a way out of that. Like, I can go off all my supplements for days at a time and not see an appreciable difference in how I function, how I feel, how I perform. The vast majority of patients who stick with us long enough to go through this process with multiple quarters, multiple iterations, see this level of resiliency start to emerge, from their body, despite their previous state of being unwell.
Yeah, and I mean, I think the interesting thing about magnesium is that it interacts with other elements, and I think noting some of the major interactions can be important, and can give a guide to maybe supplement dosing in some instances. Obviously, you need to do, for the most part, most people need to do a full mineral balancing protocol, I think, to dial in magnesium correctly. But magnesium interacts with sodium, right? And if you've got very low sodium levels on an HTMA and you're megadosing with magnesium, that could end up being a problem for you. Magnesium and calcium are in balance with one another. And whenever there's an imbalance in that ratio on the hair test, that can predict some important things, especially related to like insulin function, because calcium and magnesium send signals, or I should say the pancreas uses calcium and magnesium to signal the release and shutdown of insulin, right? So that's another very important aspect of magnesium metabolism. But aluminum and magnesium interact with each other as well.
To be clear, though, we often don't see that clearly in blood labs.
Right.
What we see is that's something that's reflected in how they feel and function. It's one of the things that I see, like, for example, someone will say, well, I feel like I can't control my blood sugar. And they'll go to a regular, or even a functional medicine practitioner, and they'll say your insulin's normal, your fasting glucose is normal, there's nothing wrong with you. They may even do complicated things like CGMs or whatever, and they may say, this is normal, there's nothing to worry about. And they say, no, I really feel this effect. I have this experience. And sometimes patients will feel like they're being gaslit by their practitioner, which is unfortunate. But when you'll actually get these minerals in balance, as we're talking about, you can see things like that improve. Now, sometimes that goes back to like bad macronutrient ratios, which is a whole nother story. But the point here is just that as we go through these protocols and give people this information and help them bring the system back into balance, we often see this sort of thing responding and improving regardless of what the blood labs say. And that's really important because, people get so fooled by blood labs, and they're so, they're minute to minute, day to day. Oftentimes your blood labs are just notoriously unreliable as far as what's really going on in terms of how someone feels, which is why people are often surprised when they come to us with a hair test and they say, like, all my blood labs are normal. What's going on with this hair test? And we say, oh, well, you're experiencing these symptoms. Or do you feel like this? And they say, how did you know? And it's because there are these very clear patterns that correlate with how people are experiencing the world.
Yeah. And so just to button up the magnesium point, magnesium and aluminum interact with each other, which I think is a very interesting metal to mineral interaction.
Yes.
And that can influence ATPase, which is an important enzyme that regulates ATP. So low energy in many people is actually a function of this aluminum substitution for magnesium. That's very important. But then also nickel and magnesium have, there's a substitution there. And they've looked at that mechanistically in the skin tissue. And since magnesium is important for DNA and RNA repair in the skin, when nickel substitutes for magnesium in the skin tissue, and it inhibits DNA and RNA repair and can make people more sensitive to UV light. So a lot of people that go out into the sun and burn, after being in the sun for like 15 minutes or 20 minutes, that can be due to a lot of different things, right? Not ever going out into the sun and then going out into the sun randomly in the middle of the day.
Just having thick skin, yeah.
Yes. But that substitution, I think, can predict skin issues and sensitivity to sun exposure as well.
Another question we have here is, should I avoid taking any herbs while doing mineral balancing?
I mean, any is a lot, but generally speaking, we like to keep the number of variables we're dealing with to a minimum. So I would at least bring it up, and then I would, pick and choose them so that you're using ones that are that serve you well. Like, for example, I put a lot of herbs that are like functional foods in my detox powder, which we have the recipe for over at Stillman Wellness in the membership area. If you're interested in it, I think it's better than all the greens out there that I could find, which is why I created it. But I put a lot of herbs in it, and these herbs are all really benign. They synergize with mineral balancing protocols. They're not going to interfere with them. So you could do that. But I'll see people doing things like, for example, taking tons of like certain teas that may have a diuretic effect. And if you're doing that, I mean, I've never seen anyone show up in the ER from herbal teas. There's not like a significant danger, but could these things like derail someone's progress? Yeah, absolutely. I'd be really curious if Clark's got any anecdotes of that actually happening in real practice.
I'm generally not a huge fan of herbs. I've seen, I've had a lot of herbalists come to me for hair tests, and sometimes their tests
I've had at least 2 come to me so far for this.
Yeah, I've seen some pretty bad tests, like really significant toxic metals on some of their.
Let's talk about why that is, Clark.
Right. Well, they're using herbs really, really liberally in many cases because they're herbalists. So they're using herbs for everything, and that can be problematic because a lot of the herbs are loaded with toxic metals nowadays.
But that's because they're being sourced poorly.
Yes, generally speaking, that's true. I do think it's not just the sourcing. It's not just the fact that they're coming from India and China. In many cases, it can be a result of processing. Exley talks about this. in respect to aluminum, right? A lot of the things that are processed nowadays are processed on machines that are made of aluminum, as an example.
Yes.
So there is that. I think that's a much smaller risk, but I think it's a risk to sort of be aware of if you're consuming a lot of anything or consistently, So I think herbs they have their place, and we actually use them pretty judiciously in mineral balancing. Like there might be a little bit of uva ursi in the ranamide, right? Yep. But generally speaking, we don't really use a lot of herbs. Sometimes if you use them for sleep here and there, I don't think it's that big a deal. But if you're using anything a lot over and over every day, I think it's worth at least investigating or being somewhat cautious about its toxic metal status.
Right. So
next question. What do you think about Celtic sea salt?
Love it.
I think there was just a report that came out. Do you follow Lead Safe Mama?
No.
I think she or the guy.
I'm gonna have to rethink my Celtic sea salt habit, Clark.
Maybe.
What a tragedy.
Decent amount of lead in one of the analyses that they just did. I can't remember if it was the Everything Lead guy or if it was Lead Safe Mama, but yeah, I think Redmond was kind of not great. The Celtic sea salt was worse, but they both showed, above the level of concern threshold, like 5 parts per billion for lead. So, but this sort of gets into, I think, a larger issue of is it possible to consume foods that don't have metals in them nowadays?
That's a great question.
Get all doomy and gloomy on me here, Clark.
I mean, if we were to really dig down and analyze, everything, there might be some small amount of metals in almost all foods.
Yeah.
So it's a matter of even it being below the level of concern threshold that the FDA has set now, 5 parts per billion for lead. It's different for the different metals.
Yeah.
Any amount of a metal it's problematic. So.
Yep. I agree.
Next question. Thoughts on adrenal
I'm still
cocktails?
going to finish the Celtic sea salt in my Yes, Amy?
Thoughts on adrenal cocktails?
Ooh, I love them. Hate them. Love to hate them. Okay. They're like a really useful adjunct if you're trying to boost your numbers a little bit. But what people don't seem to get is, let's say that you do a half teaspoon of sea salt and a half teaspoon of cream of tartar. The sea salt's going to be a double-digit proportion of your likely daily intake of salt. So it's a significant contributor to your salt intake for the day. Mm-hmm. But the potassium you get from these adrenal cocktails is, maybe 10% of what you should be getting in a day. The reason people feel so much better with them is their diets are so, with all due respect and love, pathetically deficient in potassium.
Yeah.
That they're going from the basement to the first floor.
Right.
And it just is amazing to them. And then they end up taking 4 a day, and then they don't know why their blood sugar is unstable because they're downing them with orange juice. So it's sad to me because eating a high potassium diet is just not that complicated. You eat a lot of root vegetables, particularly potatoes and sweet potatoes. You might throw in a banana if you tolerate them well. You might throw in some tomatoes or some tomato paste. And you throw in lots of cooked vegetables because those are the highest potassium per calorie food on the planet, at least as far as I can tell. And the point is just when people eat more potassium, they feel better in general. And that's the sad thing to me about the adrenal cocktails. It turns into this big dog and pony show when really what people need to actually do is understand what they're actually eating so they can actually hit their nutrient targets every day with their food rather than, going to the kitchen counter and mixing up this mocktail. It works great for social media, Instagram. It gets some people through the day. It's helpful, but it's just, it reflects this fundamental lack of appreciation for the importance of eating a high potassium diet, which is just really abundantly clear in the literature. But as I often say, potassium is the redheaded stepchild of the supplement industry because no one's ever going to make any money on it because you have to take 16 potassium capsules in order to get the same amount of potassium as you get from like one, large baked potato. So no one uses potassium in the supplementation world in any significant amount, at least as far as I can tell.
Yeah, and I mean, there's nothing necessarily wrong with the adrenal cocktail, but when people start to say that you can use it to move the sodium and potassium levels on the hair chart, that's where I sort of jump in and go, well, that's actually not true.
Right.
Because the underlying hormonal mechanisms are what control retention of those elements. And you do need sodium and potassium. Everyone has a nutritional requirement for those elements on a daily basis, right? But your retention mechanisms are really what we're talking about when it comes to HTMA. And the ability or the efficiency with which you retain those elements is determined by your hormonal status and those adrenal hormones. So you could, I've had a lot of people who've been on adrenal cocktails and their sodium potassium readings never change ever. That speaks to something deeper going on.
Right, exactly. And it's why it's very sad when we see people reducing HTMA to just, well, you've all got to eat this diet and you've all got to do the adrenal cocktail and you've all got to do this and you've all got to do that, because those people end up being wildly wrong. And then we get to fix the people that they screw up with their one size fits all recommendations. But anyway, I think that's enough for today. Don't you, Clark?
Yeah, I think we touched on a lot of the hormonal aspects. Did we lose Amy?
We lost Amy, but that's okay.
Yeah. Okay. Do you have anything else you want to say about the hormones or
I think we gave people a pretty good overview.
Yeah.
So we'll call it. Take care, everyone. Have a great day. Don't forget to get outside.